Good evening, Guelph. My name is Mark Per all of us, and that rhymes with for all of us. And I'm the People's Party candidate for the Guelph riding for the federal election in October. I hope you vote for me. And tonight I'm going to talk to you about the People's Party platform on healthcare. And I've had a lot of conversations with people about it. I'm open to talking with people about it, but I feel strongly that we need to have a change, make a change in the way things are done. And I, again, believe that Mr. Bernier's plan is the best plan. And I'll show you why I think we need to make a change and why I think this is the best plan. But first, I'll talk to you about the plan. Here we go. 2019 electoral platform, healthcare, giving provinces the incentives to deal with wait times and rising costs. Issue. Canada's public healthcare system has the dubious distinction of having the worst wait times of any developed country. Healthcare costs have been increasing at an unsustainable rate, putting more and more financial pressure on the budgets of provincial governments. The situation is likely to get worse with Canada's aging population. Healthcare is an exclusive provincial jurisdiction. However, for years, the federal government has insisted that provinces satisfy a series of conditions set in the Canada Health Act in exchange for transfer payments. These conditions discourage innovation. Also, the money does not directly fund healthcare services. It is simply added to the province's budgets, and they decide where and how they spend it. All this confusion and undue interference leads to bickering between Ottawa and the provinces over who is responsible for the failings of our healthcare system and how much money Ottawa should contribute. It prevents the implementation of sound reforms. Facts. Canada is among the OECD countries that spend the most on healthcare. Ottawa's healthcare transfers to the provinces have doubled since 2006, from $20 billion to $40 billion in 2019-2020, with nothing to show for it. The fundamental problem is that we're the only developed country where the government has a monopoly on medically required care. All other OECD countries have mixed private-public systems. And, with the exception of the United States, universal systems that guarantee citizens equal access. Patients in these countries have a lot more choice than Canadians. They can be treated in public or private hospitals, with the government or their private insurance paying for the treatment. Wait times are non-existent or very short, and nobody is denied care because of low income. Our plan. It is up to the provinces to implement reforms in line with the more efficient and less costly mixed universal systems of other developed countries. Throwing more federal money at the problem is not the right approach. On the contrary, it is part of the problem. Provincial governments will never make the tough decisions if they can always blame Ottawa for not sending enough money. We must end the current confusion over who does what and who is responsible for the problem. A People's Party government will replace the Canada Health Transfer cash payments with a permanent transfer of tax points of equivalent value to the provinces and territories to give them a stable source of revenue in practice. Ottawa will give up its goods and service tax, GST, and let provinces and territorial governments occupy this fiscal room. In 2019-2020, the GST is expected to bring in $40 billion in revenues, the same amount currently transferred by Ottawa. Establish a temporary program to compensate poorer provinces whose revenues from the tax will be lower than the transfer payments they used to receive. Create the conditions to provincial and territorial governments to innovate. They will be fully responsible for healthcare funding and management and fully accountable to their citizens for the results, while Ottawa will respect the Constitution and stop meddling. So I think that it buries the lead, this article, because Ottawa is saying, and the reason that this video has taken me so long is because I wanted to talk to Bernier and talk to the headquarters to make sure that what is written here is what we mean, that Ottawa will give up GST and let the provinces occupy that. That means that not that they're repealing the GST, but that they're giving the GST fully to the provinces to control. So that's interesting. And I talked to headquarters. I haven't talked to Mr. Bernier. I have asked for Mr. Bernier to come on my show to discuss this with me, and that is in the works. I hope that comes together. I'm not sure if it will, but I hope it does. However, I think that's a big deal because it's not like if the province's healthcare gets more expensive that the provincial government can say, okay, we're gonna raise the PST, GST, whatever it is, that tax, because that would be unpopular and difficult to push through, especially in the current climate. So I think that doing it this way incentivizes a system that actually has better outcomes than Canada. And I'm going to show you that. Here's Global News reporting on July 14th, 2017. So this is modern, but a couple of years old. So be aware of that. The link is in the description if you want to read for yourself. It says Canada's healthcare system is third last in new ranking of developed countries. Okay. Canada has been ranked third to last in a detailed new study comparing the healthcare systems in 11 developed nations, managing to beat out only France and the bottom-ranked United States. The study, published this week by a New York-based private research foundation called the Commonwealth Fund, focuses largely on America's dismal performance, but also reveals stubborn weaknesses in Canada's system that keep us lagging behind top-ranked countries like Australia, the United Kingdom, and the Netherlands. According to the study, which relies on 72 metrics grouped into 5 distinct categories: care process, access, administrative efficiency, equity, and healthcare outcomes, those weaknesses include Canada's comparatively higher infant mortality rate, the prevalence of chronic conditions, long wait times in emergency rooms, and to see specialists, poor availability of after-hours care, and a lack of reliable coverage for things like dental work and many prescription drugs. The document makes it clear Canadians are not getting value for money, spending the equivalent of 10% of our GDP on healthcare in 2014. Meanwhile, many higher-ranked countries spent less and still managed to come out on top. Yeah, right. So we're expensive and our outcomes are not very good. And I wanted to dig into this report, and this report is interesting. It's very United States focused. It's a US study, so it's not a surprise that it's United States focused. I read the study. I thought it was interesting. The most interesting part is the timelines. Well, not the most interesting, but the thing that stuck out to me is where Canada falls short. And this question is, well, I mean, all of these questions are interesting in the answers. This one is regular doctors always or often answer the same day when contacted with a question. So can you get care on the same day? And most of the countries are, 80, 85, 86, 87. Canada's at 66%. There are Norway, Sweden, they're at 76, 75. The US is the closest to us at 72%. That's wild, right? Like that's pretty stark. There are other interesting ones, and I've got a list here. And there are some that we're right in the, right there at the top of the pack, no problems. But it's the ones that stand out, like, waited 2 hours or more for care at an emergency room, right? That's a lot of people, 50%. I was in an emergency room for 6 hours. Everybody said, that's short. Good job, right? So waited months for a specialist appointment. Again, these are glaring things that Canada has to deal with. And the numbers are Australia at 13%, Canada at 30%, France at 4%, Germany at 3%, Netherlands at 7%, New Zealand at 20%, Norway at 28%, Sweden at 19%, Switzerland at 9%, UK at 19%. So again, these are measurably, we're the worst on that one. And it is concerning that despite the evidence that we could do better, and the evidence that throwing money at this problem in the form of transfer payments, or having the federal government say we're going to increase the healthcare by this much percent over the next couple of years, that is the same as throwing money at this problem, doesn't attack the core problem, and it doesn't solve the issues inherent in our system. And I think it's time for a new direction. I think that the new direction is worthwhile and has been tried in other countries, and not other small countries that have a private system that overruns the public system, but Germany, France. Like these are big countries with long histories, and their outcomes are much better, right? So, well, the 11 country average, right? Germany is one step up from us. So maybe the improvements of the wait times coming down are that important, though. Hallway medicine is something that has been ubiquitous in talk about healthcare in the last decade. This is happening in real time. I don't want my parents to have to deal with that in an emergency. I personally don't want to have to deal with that in an emergency. Dignity in these kind of situations is hard to come by. It's even harder to come by when you have to sleep in a hallway around nurses and doctors and other people trying to do a job that is impossible at the best of times. So, thank you very much for listening. Thank you very much for watching. Have a wonderful evening. If you have the time, head over to ppcguelph.ca and check out the other videos I've put up, etc., etc. And, well, thanks for watching, Guelph.